देखे पूरा खाली है. Hello, dear students. Within 5 minutes we are starting. Please sit. Please sit. Praveen, Alok. Am I audible? All of you, please listen carefully. Within 5 minutes we will start another session. Please ask your friends. Rajat, what are you doing? Rajat, कहाँ? बच्चों को बुलाओ, बैठो. 5 मिनट में शुरू होगा. 5 मिनट में दूसरा सेशन शुरू होगा. Please call your friends. Praveen, please see to it that all of them will join. Within 5 minutes we'll start. Alok, please check with your students. We'll start within 5 minutes. All of you, please sit down. Don't roam. B3 class. बैठो. Praveen, please call all of your students. Yes, sir. Please call all of Alok, please check those who are roaming on the corridor. Please ask them to be there. Praveen, please see to it that all of them join. Yes, sir. Praveen, please see. Join करो सब. प्रवीण थोड़ा बाहर जाओ. कॉरिडोर में जो घूम रहे हैं उनको बुलाओ अंदर. डॉक्टर, लिंक में दिया हुआ है. डॉक्टर मैं इसमें व्हाट्सएप में भेजूं? मेल में है सब डॉक्टर. उसको खाली क्लिक करने से हो जाएगा. अच्छा. ओके मैं भेज रहा हूँ. पासपोर्ट और किसी ईमेल पे नहीं बोल पासपोर्ट कॉपी कौन लिंक किसी ने कौन लिंक को भेजी? ओके, भेजो फिर से भेजो। वीडियो कॉल लिंक हो रखा है। डॉक्टर, आपको जो मेल किए उसमें जो एचटीटीपी की वो लिंक है उसको क्लिक करेंगे तो डायरेक्ट आ जाएगा। पासवर्ड ओके, मैं वो जो वीडियो कॉल लिंक लिखा है ना डॉक्टर उसको क्लिक करें। पासवर्ड आ गई। ठीक है, गूगल मीट में जाके इसको और एक मेल अभी भेजने हैं। हाँ कोई यस उसको क्लिक करिए। हाँ ऑप्शन है क्लास टू जॉइन या प्लीज ओके। तो अभी और एक आप गूगल मीट में जाइए और एंड एक अभी और एक पासवर्ड भेजे हैं उसको या गूगल जाइए एक CJW भेजे जी जी गूगल मीट में आप जाके ये जो वर्ड डॉक्यूमेंट भी है ना उसको कॉपी करके उसको पेस्ट जॉइन द मीटिंग करते रहेगा उसी। जी 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 या नहीं तो आप नहीं या नहीं तो आप क्या करेंगे वो व्हाट्सएप को आपके लैपटॉप में सिंक्रोनाइज करवाइए। तो मैं व्हाट्सएप में देता हूँ उसको भी हेलो कहीं रेट कम कर चाहिए नहीं पर लग चाहिए सो तो नहीं यस डॉक्टर यस डॉक्टर यू हैव जॉइंड। Hello, doctor, am I audible? Hello.
Hello, can you hear me?
Yeah. Good morning, doctor. Good morning.
Good morning. Sorry, unfortunately, I have to be on a mobile phone so that we can talk
Okay.
as well. Is that okay? Because somehow I cannot connect with my laptop.
It's okay, doc. It's okay. It's okay.
Can you see me clearly?
Yeah, it's clearly visible.
All right. Okay. Hello everyone. How are you?
Sir, we
Yeah.
are fine, sir.
Hello.
Thank you, sir.
Thank you. Sir, करो ये divided. Sir, good morning, doctor. Thank you very much
Good,
for joining.
good morning. Good morning.
Yeah. And good morning, dear students and my dear colleagues. Welcome to Danteswari College of Pharmacy. On behalf of student, staff, and management, I heartily welcome you to Danteswari College of Pharmacy, Doc. And this time we missed you. Very recently, you have returned back from India. Next time, whenever you are coming to India, please give me a ping so that we can have you here physically. Long back,
Definitely.
during 2005, you had
Yeah.
visited Jaipur College of Pharmacy, and it
Right.
was a great moment. I had shared
Mhm.
you and Dr. Purandare all the photographs of those days. I hope
Right.
you
Right.
have liked it. Thank you,
Absolutely. Thank
doc.
you.
Thank you, Dr. Tere.
Hello. Yeah.
Uh, my dear friends, here is Dr. Srikant Dhumal, who is a very good friend of mine. Sir has completed his PhD in analytical chemistry, and he was working with me in Cipla Limited, Mumbai. We had great days those days. And after that, Sir has moved to Australia, and right now he has got two analytical labs and state of the art, and it is one of the best in Australia. You know, testing labs, whenever pharmaceutical dosage forms are to be analyzed, it is to be analyzed in a specific lab and should be accredited. Then only government, any country's government will allow you to analyze. And he has got two labs and also a formulation unit. So, sir, we are fortunate that with lot of schedule, he has got lot of schedules today even. And just 2 days back, he had been to Australia back from India, and he was having fever and all. 2 days back, he was supposed to join, but he was unable to speak. So, thank you, doctor. After all these, you could able to join. Thank you, doctor.
Thank
It's
you.
over to you. Please uh, deliberate your analytical on this
Sure.
pharmaceutical analysis, particularly to our
Yeah. Yeah.
student and staff. Over to you, doctor.
No problem. Can you see me there?
Yeah, it's very clear.
Okay.
We can
Okay.
see you, and voice is also very clear, doctor.
Very clear. Now, let me, because I may have to show you some of the pictures as well.
Yes.
So you can, okay, fine. Yeah, now I can see myself as well. That's good. Now,
Ye-
good morning, everybody. Good morning, my friends. Uh, all the youngsters, good morning. Can they hear me?
Ohare.
Hello? Can
Good
all of
morning,
them
sir.
hear me? Good morning. Good morning. Can the youngsters are listening as well? Can they hear me? Can
Good
all of
morning,
them
sir.
Raise your hands at least.
Can the youngsters are listening as well? Can they hear me? Okay, good. All right. Okay. So, okay.
Microphone. Yes, Praveen. Mute your microphone. Praveen, Alok. Yeah.
All right. Okay,
Right. Over to you, doctor.
let me explain to you what myself, who am I, what I'm doing.
Yeah,
As
please.
Shruti has explained that I did my PhD in Mumbai. So I completed my PhD in analytical chemistry. Then I was working with Cipla with Shruti. And then in 1993, I moved to Australia. I was working in various places in Australia as a general manager, production head, quality head. Then I decided to start my own thing. So then I was working as a consultant for various industries to ensure they get a license from TGA and FDA to start manufacturing. Then once upon a time, my wife told me, why you are working for all the people? Why don't you start your own? So then I started my own business. Now, proudly, I can say that I'm the top in chemistry testing in Australia. So that's one of the top thing I have achieved. Thank you very much. What I have achieved so far. Now, let me explain to you guys. Like I know you all are doing pharmacy degree, which is great. Doing a degree in pharmacy is important and a great thing. But what is most important thing is you may produce a best product, but if you do not analyze that with the great accuracy and precaution, it is worthwhile, worthless as well. So having having an analysis technique knowledge as well as manufacturing knowledge also helps you. So what I normally tell my pharmacy graduate students, okay, you must need to understand how to manufacture the perfect goods. But at the same time, you need to have understanding of how this is analyzed. For example, if customer can make brand new product, which is the best product, but if I don't analyze them accurately, it may end up in a garbage bin. So it is not a worth doing thing. So testing of the goods correct way is an important part of it. So what I will do now today, I will go step by step. What are the things required in a good laboratory to make sure that you are analyzing the product accurately, correctly, and genuinely? In analytical lab, what you need to be is very genuine. The genuine is, see, if you get an OS or something fails, you must tell immediately something is failing. If you should not manipulate the data. One thing is there in a chemistry lab is no is a manipulation. You should not manipulate any data because that has got a diverse effect on a patient. If example, if you release a batch which is not complying with your specification, a person may die on other side. So that's a risk. So analytical chemists are literally a god for the product that has been manufactured. And that is what I will go step by step what we are and what we do. So the first thing what is important is quality management system. So I will show you what that means. So this is QMS. Can you see it's upside down or it's correct way? It is upside down,
It's
right
correct,
there.
doctor. It's correct, doctor.
Can you see QMS correctly there?
QMS. Yes, doctor.
Right. So QMS is a start of any lab, which is a quality management system. Now, without QMS, you cannot make any laboratory functional. In a QMS, there are various documents required to make sure that your lab is functional, such as like standard operating procedure. Let me show you what I mean. Unfortunately, I could not make presentation because I was sick till yesterday. So this is another part is required, which is standard operating procedure. So you must need to have standard operating procedure for each test what you are doing, such as how to operate, example, HPLC, how to operate gas chromatography or pH meter. So in a lab, you must need to have a correct procedure how to operate that machine correctly. So that is called SOP. Right? So SOPs are required to make sure that you are doing the right thing all the time. So this is the mandatory, and there is no excuse that you should not have SOPs for that. Now, once you have all the correct SOPs, you need to have a proper training as well. So the next step is a training to the staff. Now, the training cannot be given by any individual who has got no knowledge or very less knowledge of that subject. Now, in our lab, I give a training to my staff, even how to weigh the sample correctly. Because if you do not weigh the sample correctly, unfortunately, you're going to have false results as well. So weighing is important. How to, like every part of it, even how to hold the burette, how to hold the pipette, how to make a dilution. So that sort of training is required to be given, because this is a critical area. As I said, if you make a mistake, you can make a batch fail, and that can have a very bad repercussion on a finished product, which may be the good product, and by our mistake, we may have to put in a garbage bin. So training is very important, and training need to be very thorough. Okay, so that is what happened. Now, what I will do, I will just show you the lab now, and then we will go from there. I will tell you about each and every instrument, what is it used for. In the meantime, if you have any question, you may ask me questions as well. Sorry, my voice is not that great, but I'm trying my best to see whatever I can. Okay, so I will show you the lab now. It's how do the camera thing. Okay, I will just show you this particular way. So this is the entrance of the lab.
Okay.
Can you see clearly?
Yeah, so it's clear though.
Okay, good.
Students, please be attentive. See the lab. This is an opportunity to see a analytical testing lab. Please see.
So this is HPLC, which is from Shimadzu from Japan. Now, this is a normal phase dedicated HPLC. So here we do all sort of non-polar substances. So what is non-polar? The substance which are not soluble in water, methanol, acetonitrile, or ethanol. So they are only soluble in higher organic, such as hexane, heptane, isopropane. So this machine is dedicated to do all non-polar substances. So which is called as normal phase HPLC. Now, this is another HPLC, another Shimadzu, which is reverse phase HPLC. So here, this machine can do anything that can be soluble in a polar solvent, such as methanol, water, acetonitrile. So this is another HPLC, which is Equity from USA. This is another reverse phase HPLC where we do all polar substances. This machine is ICP-OES, which is inductively coupled plasma. So here we analyze all metals such as sodium, potassium, calcium, iron, which is a part of most of the formulation. Also, we analyze various type of heavy metals which are restricted nowadays in any formulation, such as lead, arsenic, cadmium, and mercury. So they should not be present in a formula. So this machine can detect up to 0.005 ppm mercury. So very sensitive machine. Also, all the heavy metals such as arsenic, lead, cadmium, mercury up to 0.01 ppm easily. So these are the limits. So limits in Australia are 0.1 ppm. So my machine can go very less than that particular required concentration consumed by Australian product or Australian people basically. So this is called ICP-OES, inductively coupled plasma. This is another machine called GCMS. So this is gas chromatography connected with a mass spectrophotometer. And here, what we do, we generate the gas. So this is a hydrogen generator. It generates the gas for the machine to operate. So when the sample set is completed, the generator stops. So they're all at auto machines. For example, they select the samples from the vials. So you can see now here, that many samples have been put in a carousel to make sure that they injected sequence one by one. So this is GC. Now GC is used for doing all the volatile solvents, ethanol, methanol, residual solvents, all sort of things can be analyzed by this machine, as well as various oils such as fish oil, peppermint oil, flaxseed oil, you name the oil, those oils, fatty acid, non-fatty acid, can be analyzed by this machine. So this is GCMS. Now, this is another HPLC from Perkin-Elmer. Now, you can see there are two detectors. One is a PDA, and there is a RI detector here. Now, PDA detector means whatever molecule has got a benzene ring, all the benzene ring molecules, such as maybe aspirin, paracetamol, like you tell, ibuprofen, or various different product, or ascorbic acid. So whatever component has got benzene ring can be analyzed by this detector. Now, this RI detector is mainly for all aliphatic compound when there is no benzene ring, such as sugar molecule or sucrose, fructose, lactose, galactose. All these aliphatic compounds can be analyzed by this detector. So this machine, if you tell them to switch over to PDA, it switch over automatically. If you tell the machine switch over to RI, it does the same thing as well. So these are the two different detectors. So here we have multiple detectors on various machines. Now this machine also have a PDA detector, as well as this is fluorescence detector. Now some components do not have lambda max or absorbance at certain at all. So there you have to analyze those components by fluorescence. So there you inject the sample and make sure that there is a fluorescence, or you create the fluorescence and you analyze the fluorescence, what is obtained from that sample. That is by this HPLC once again. This is another German HPLC. This also have all the detectors and does the same thing as a PDA as well as RI detector. Now, this is what the instrument room we have here now, but we have some more machines upstairs. So let me show you something which you may not be known about it. Now, you can see my name here. I'm a part of US Pharmacopoeia, and they normally send me engraved US Pharmacopoeia monographs. So I represent US Pharmacopoeia for Australia, New Zealand. If there's a problem with the US Pharmacopoeia, they contact me to make sure that I help them to resolve the problem. So this is a part of instrument room. Guys, can you hear me? Hello? Shruti, can you hear me?
Yes, doc. You are audible.
Okay, so this is about the instrument room. Now, see, as I said, like you are analyzing samples on a various machine, but they need to be prepared somewhere in a lab. So this is my wet chemistry lab. So here we prepare all the samples. So these are the weighing balances. Now, unfortunately, all the staff has left because it's 5:30 now here in the evening. So here we prepare all the samples. We get variety of samples from various customers here for testing. So this is all where we store all the glassware. Like here we store all the pipettes. Then here there's another set of pipettes. All the different glasswares are stored. And these are the workbench where we prepare a sample and do the testing. So this is the fume hood where we prepare all sort of samples that creates the gases and fumes. So this is the area. So once I show you the lab, then we go in a details of testing. What are the testing normally expected from various pharmaceutical company, and what are the challenges we have? So this is upstairs area again. Once again, we have another ICP OES to cater the demand because we are so busy. We can't catch up with the work. So we got another ICP OES. This is Avio 220 Max. This is ICP OES. This machine is FTIR. So this is mainly used for identifying a product. So example, if you say my tablet is ascorbic acid tablet or paracetamol tablet, by having this machine, when I put a sample on this crystal, on this platinum crystal, and I squeeze it, I get a spectra. And there is a library, and it can tell you straight away, oh, it is paracetamol, or it is not paracetamol. So this is a very sophisticated machine with all the software in it, so that can determine all the different molecules. I got a library for around 10,000 molecules in my database. So when I put a sample in, immediately within 2 seconds, I can tell you, is it really paracetamol or something else? So this is called as FTIR. This is UV visible spectrophotometer. So this is used to analyze anything that is between 200 nanometer to 800 nanometer, from colorless solution to colored solution, such as like aqueous solutions, which is a colorless solution, has got lambda max between 200 and 255 nanometer. As the color goes up, like example, yellow color has got 400 nanometer, red color got 550 nanometer, blue has 650. So different color has got different lambda max absorbance. So this machine is used to analyze all the sample that has got a colored components in a formulation or substances. This is called a nitrogen analyzer, which is a LECO machine. So this machine, you must have heard names such as Caldar analysis for doing nitrogen and protein. Nowadays, that technique has gone away. So this machine, you prepare a sample in this small weighing board, put in the machine, you get result within 5 seconds. In a traditional method, for Caldar method, it takes around 3 hours to 4 hours to get the results. But this machine can give you results within 5 to 6 seconds. So this way we got a PLC chamber analyzer, we got weighing balances, moisture balances. Then these are the Carl Fisher potentiometer. So here, this Carl Fisher is to analyze moisture content in a formula. In a pharmacy, you must be knowing about loss on drying and moisture. If you have more moisture in a product, you may not be able to make a tablets. So the moisture need to be controlled. So we analyze all the different raw materials, finished product, to make sure that the moisture is controlled in those components so that you can make a final finished product correctly. So these are all potentiometric titrator to analyze to do the assay and various other things. So this is a lab upstairs. We are entering now into microbiology lab. This is approved by TGA. So here we have various incubators and laminar flows. So this is BOD incubator. So here we analyze all the finished product and we test them for pathogen testing. So in this lab, we test all the pathogens such as E. coli, Salmonella, Staphylococcus aureus, TPC, yeast and mold. So all these incubators are used to incubate those samples and analyze if there is a microbial contamination in a finished product that is consumed by people. In a way, there should not be any microbial contamination in a finished product. If there is a contamination in a finished product, people may die. So as a pharmacist, you must need to ensure you make a correct product. At the same time, you make sure that your water quality, your environmental monitoring is perfect to ensure there is no microbial contamination in your finished product. So these are the laminar flow where we prepare the samples. Once we prepare the sample, they go in incubators. You can see there are a lot of plates here. They're ready to be read tomorrow, because once you put them in an incubator, you have to cool it down and read the plates. Once you read the plate, you will see straight away like how many batches are contaminated. So there is called a GMP, GLP, all different, like these are all the media required for microbial preparation. This is autoclave. In a microbiology, we have to make sure that the glassware or the whatever we are using is sterilized before. If you do not sterilize them properly, you may get a false positive results. So we do not want false positive results. We want accurate results. So we sterilize everything what we use before we test the sample. But what meaning of sterilization is, kill all the bacteria in your glassware, in your water, in your media, all your gloves, what you're using, and then you test the sample. Because you do not want a positive contamination or false positive results. So hence, the autoclave is used to sterilize the components. And these are the machines, they are used to read the plates. I can see there are so many plates in the incubator. Now, these are all for E. coli testing. This is all salmonella testing happening. in the incubator. So I'm not going to open that because I do not want to contaminate the products, basically. So this is the overview of the machines, what we have. So you have to, in a micro lab, you have to have gloves, safety shoes, hand sanitizer. You have to be very cautious while what you're doing in a micro lab. All right, so this is all about lab and equipment. Now, guys, if you ask me question, I can go to that direction because I do not know what sort of area I should target for discussion because I'm just keep on talking about so many things. Shruti, do you have any specifics I need to talk about?
Yes, Doc. See, like analysis, when we do formulation, we analyze in a lab that
Yeah,
is as per the different pharmacopoeias.
yeah.
Like that, our students should know that in Australia, do you have any specific pharmacopoeia or you do test in USP only?
No. We follow British pharmacopoeia.
British
In
pharmacopoeia.
Australia, the norm is to follow British pharmacopoeia because MHRA and TJ has alignment, and this is what they do. They say that product if the product pass as per BP, then there is no issue. So first preference is British pharmacopoeia. Okay.
First
Now let me tell you
preference is
my
British
license.
pharmacopoeia.
Yeah, this is a license what we have. This is a TJ license on my name. So I'm a license holder for Therapeutic Goods Administration. And we
Right.
are authorized to do manufacturing testing of all different products in Australia. So this is a part one. Uh, this is a license for my lab for another lab, which is on other unit, which is a food lab. So this is a NATA license, which is ISO 17025. It's a Came Chrome food laboratory.
In
And there's another
India, Doc.
license we have is testing animal products. So we are authorized to test animal products as well. So this is with APVMA license to test all the veterinary products. So
Okay,
yes,
doctor.
BP is sorry.
To test in India, there
Yeah,
is all the labs has to be accredited. That is, NABL accreditation is mandatory over India. Do you
that is what.
have such kind of accreditation system in Australia too?
1 minute. Let me enlarge this. I don't know what happened here. Okay, now I'm okay. Sorry, come again. You can ask me question again.
Yeah, to start any testing lab in India, you
Mhm.
need to have NABL accredited lab. You mean
Right.
your lab has to be accredited by National Accreditation Board. Do
Absolutely.
you have in Australia any such kind of accreditation system also?
Yes. We have a TGA license. As I show you the license, which is called Therapeutic Goods Administration. So TGA, APVMA, FDA has got a similar guidelines or similar procedure. Rather, I can say TGA license is the most tough than US FDA or MHRA because TJ people are very tough, even though they don't have any mercy. Let me tell you, they are so thorough in inspection. They will ask you so many questions, and they are so honest at the same time too. Like I can tell you, I got an audit next month from TGA, and they send very clearly in a report, no sandwich will be given to me, no
No.
water. If at all, if I provide them a sandwich, because if the food stall is some far away, at the end of the day, he will ask me, Shrikant, how much is total bill for bottle of water, sandwich, and an apple? And I tell, okay, it's $11. He gave me $11 at the end of the day, and he walk away. So this is how it is. They don't take not a single free from anybody. They are very
Yeah,
honest in what they're doing, and that's what I've
that's
seen for
great.
last 30 years.
That's great,
So,
doctor. One more
it's a,
question, doctor.
yeah.
Like in India, we do we are free to manufacture Indian pharmacopoeial products, British pharmacopoeial products, and also we manufacture as per US pharmacopoeia also.
Yeah.
So, is it there in Australia? Do they follow only BP USP? Is there any chance of Indian pharmacopoeial products are being manufactured and tested over there?
I have not seen anyone manufacturing Indian pharmacopoeia products in Australia. That is to be honest. Like they only follow USP and BP. Yes, there are some herbal products that are manufactured, but they are okay. There is a different category. Now, when you say BP or USP products, this is called as OST-R, which is called registered product. In Australia, there is a categories given for various products. So anything that comes under BP or USP, that is called as OST-R. Anything that doesn't come under BPUSP, such as let's say a turmeric powder. A lot of people make turmeric powder or echinacea powder or ginkgo tablet, whatever. Now they are not in a pharmacopoeia, so they come under listed product category. So here there are two categories. You can still manufacture as a listed or registered product.
Nice. Thank you, Doc.
Yeah.
Students, do you have any queries?
Yes, sir.
Yeah, please, Rahul, please.
Good morning, sir. Am I
Good
audible to
morning.
you?
Yeah, yes, of course I can hear you.
Myself, Rahul Dubey, sir, from B Pharmacy 7th semester in Danteshwari
Okay.
College of Pharmacy.
Yes,
Sir,
Rahul.
my
Yeah.
questions to you is, what would you say is your biggest weakness and which part of the job do you find the most challenging?
Okay, my biggest weakness is to hire right staff because what happens is those hiring the right staff is a critical part. And sometimes my weakness is I can see people write so many things on a resume that I have done this, I have done that, I have done this, and I offer them a job. When I find that person, when I put the person on a job, he is not performing well. So that is my weakness because I go based on the resume. I ask question because most of the time people can do very well on a resume or interview, but when it comes to actual testing, that is they can't perform well. That's my weakness, definitely. And the area for improvement for me is to make sure that I do learn something. But again, the problem is people, right people are not applying for the job, or if the right people are there, they demand more than required, and that's the problem. Yes, so I do have weakness, and I do have an area for improvement as well.
Okay, sir. We all
Thank you,
feel
Doc.
very happy and motivated after hearing you, sir.
Thank you so much.
Thank you.
Okay.
Any other student? Do you have any questions,
Now
please?
I
Yes,
still
sir.
have to continue. I still have to continue with a lot of things which I need to continue with the testing part of it.
Yeah, please
Then
go ahead, Doc.
then we can ask more questions on that. Okay.
Yeah, okay,
Now,
Doc.
as I said, the training part is really important. You must need to train people. Now, training is in a such a way, as I said, you must need to train people even how to weigh of different type of sample. Example, weighing cream is a different way. Weighing tablets is a different technique. Weighing liquid is a different technique. Handling the burette, holding the burette, how to make it make up to the volume to 250. It's a technique as well. So you have to train the staff from the beginning to all the way to make sure that they are doing the right thing. Let me tell you one example. One of the fellow, he's a very young man. He started in the lab, and I trained him. And then I realized that he started getting OOS, out of specification. So I saw that and I said to him, okay, can you please show me one thing? Can you show me how you are weighing your sample and standard? So then he showed to me, oh, I weigh standard in a weighing boat. Then I tear the weighing boat and I transfer the standard into volumetric flask. I said, that is incorrect. What you should do is you put a weighing boat on a weighing balance, tear the weighing boat, weigh the sample, and then you write down the weights and you would rinse that weighing boat completely with the solvent, whatever you're using. Then he said, but I do not have enough weighing boats. And that's what I have done it. I said, then you should not do that at all because that is what creating the OOS. So how you weigh the sample, how you transfer the sample is important. So training is, and even the police people are trained. You must need to train them because in one organization, they may have a different way of training. So what I do in my lab, even the people are trained. So I got like recently I have hired somebody who has got 15 years experience. So even though he got a 15 years experience, he must have to go through all the training. First thing, he must read and understand my SOPs because every SOP in each organization are different. Then you need to understand all my weighing techniques, volumetric flask technique, where I put, how I rinse my flask at the end as well. Because like training is like here in India, what happened? There is a luxury that you may have somebody to clean your glassware. Here we do not have that luxury. So example now, I put around 15 sample on HPLC. So after preparing the sample, I must need to wash them correctly. Say example, if my solvent which I'm preparing sample is a non-polar, okay, then I must need to rinse that first with ethanol, then methanol, then with water, and then put it for washing. If I don't do that, washing means I have to put in a dishwasher to wash it. If I don't take that corrective action correctly, the next person who get that glassware, he may have OOS. So this is what the training is. So we train the staff like what is your solvent and how you should clean it. That's what it is called as cleaning validation. Like you must have learned cleaning validation technique that in which solvent all your residues can be correctly cleaned. So next line will be clear for next manufacturing. Same thing happen in lab. So when I rinse my glassware correctly, so somebody else can use that glassware very thoroughly and use it properly. So training is important. Now, second part after training, like see, one thing happen that things can happen in a lab, which is called as incidents. So as I gave you example of that particular example, like the guy was not weighing properly and he got an OS. So there I have to raise the incident. Now incident is the accident people are making which can cause the failure of the product. Now, not only incident is also example now, you started HPLC and in the middle of the night, you went home and there's the power gone off. So it's not your fault. So the next day morning, you have to raise the incident to write down exactly what happened. You prepared the sample as per the method. That's my procedure. That's my sample weighing. This is my book. But in the middle of the night, the power was failure and hence my machine stopped. So that is called incident. Or sometimes people prepare mobile phase and they do not adjust the correct pH and they realize next day, oh, they didn't add correct phosphoric acid. So that is incident. So in or you prepare sample. So example now, I have prepared 10 sample. And while I was taking my samples from my desk to HPLC, the accident happened and I broke my flask. So I have to re-prepare that sample again. That is also called as incident. So you have to be very honest in writing the incidents because incidents are common and that happens. So when the auditors do come, they look for your training records, they look for your SOPs, they look for your incident. You know what I mean? What are the incidents that are commonly happening in the lab? And then once the incident happened, then you have to find out what is, if something fails on still on top of that, you have to raise the OOS. OOS is out of specification. That means the product is failing. It do not comply with the required pharmacopoeia limits. So example, if paracetamol label claim is 500 milligram, the lower limit is 90%, upper limit is 110%. So instead of 500, if you get consistently 480, it's OOS. Or if you, like example, label claim is 500 and you're getting 480 for single analysis and 550 for second analysis, it is still OOS because one in, one out, it's still OOS. So OOS need to be raised. Now OOS always, whenever there's an OOS happen, it leads to either failing the product or dumping the product. So you have to be very cautious. In a contract lab like us, it happens like if somebody send me a sample, if I get a OS result, I have to be very, very, very sure that this is OS. Because here, there is a penalty. If they send the same sample some other lab for testing and they got passed, they will send you, they will sue you for at least $80,000 or $100,000 for their losses during production for that many days. So you have to be very cautious about testing. If it is failing, you have to be very sure it is failing. So OS are very critical. OS are important, but at the same time, if you take a maximum precaution, OS can be avoided. Like, OS means like false positive OS or false negative OS. This is what I'm trying to talk about. You should not have false positive OS. You know what I mean? So that means false results. So the correct OS, so proper training will avoid a false OS. So training is required to make sure that you are doing correct thing. So after the OS, what happened when you get an OS or incident or out of trend report? You may have to change a procedure. Now, as I said, we write SOPs, but as per TGA, it is not easy to change the SOP. Like you can't make one procedure today and you're not happy, you make another one. But then you're like, I don't like the procedure, I will make another one. No, this is not right. So that need to be done by correct procedure called change control. So when you make an SOP, you cannot change the SOP because you want to change the SOP or you don't like the SOP. You have to raise the proper change control. And here you have to write down what are the reason you want to change the SOP. And your manager need to approve that changes, whatever he says, oh, the mobile phase is incorrect, the column need to be changed, temperature required 35 instead of 30, peak shape is not good, and that's the reason I'm changing the SOP. So manager need to see all those points and then he authorizes to change the SOP. So change control is a part of laboratory, which is very critical that changes cannot be made just because you want to make a change. Once you have a lab, once you have a procedure, it could be NABL, it could be TJ, it could be FDA. You are not authorized to change the procedure unless there is a justification. So you must need to have a solid justification why you require change control. So another thing is what will happen is most of the time you get a customer complaint. So I can tell you one thing. Customer is not happy all the time. Like we all complain about each other. This product is not good. I didn't like this shirt. I didn't like this color. Oh, look at this pen. Something wrong with this pen. We always complain. Complaining is easy. But again, looking at the genuine complaint, you must need to have a proper way of recording the customer complaint. You get a complaint. We get a complaint from customer that, oh, Shrikant, this result doesn't make sense. I said, okay, can you send me the official details of that complaint? So I lodge that into my form and write down, and I go back and investigate. What could be the reason this customer is telling me that he's not happy with this particular results or something wrong? So I have to go back and investigate my procedures, my data, my testing data. I will have to go to back HPLC, pull out all the raw material data, verify all the chromatogram, and see if the customer complaint is justifiable. If I'm happy with all whatever I have done, I write back to customer, thank you very much for your complaint, but I cannot do anything further about it because I have done the full investigation. So customer complaint need to be investigated because that is the mandatory requirement from TGA as well as FDA, APVMA, MHRA, or NABL, whatever you say. So this is important.
Right.
So after all this, like example, if you get a complaint or if you get something, and with the complaint, if you find that yes, you have made a genuine mistake, fine. It is sometimes you have to accept you have made a genuine mistake. So that need to be done. Deal with a word. You must have heard this word CAPA. It's corrective and preventative action. So corrective and preventative action. So what is corrective action? So you got a complaint, you investigated that, and you found the root cause. So there is a corrective action. So you found the root cause, and then you do a preventative action. That means it could be a change control, it could be SOP, or it could be a procedure, or it could be a training. So
This is,
kappa is important.
sorry,
Kappa
Dr.
is a,
Kumar. Yeah, this is a very important thing, my dear student. What Dr. Dhumal is saying, it is applicable to your daily routine also. Kappa, you have to analyze where you are having problem, and you have to rectify that. Yes, Doc. Doc,
yes, corrective action.
we do have another session, so within 10 minutes we have to be. I mean, close some other day again. We will discuss on this. So please, and after that, we need to have some interactive session with the students also.
Okay, okay.
Yes, Doc. Yeah.
I will just try to complete my
Yeah.
part.
Yeah.
And
Yes, Doc.
now, this kappa, as I said, kappa can happen for many reasons. So here, the most important part in a lab is a calibration. Now, each of your machine must need to have a calibration sticker. Now that means the machine need to be under calibration. So I always tell my staff, if the machine is not under calibration status, do not use the machine. So before you use the machine, it could be HPLs, it could be GC, they must need to see they are in a calibration status. And that should be a sticker attached there. You know what I mean? There's another thing is called as a deviation, which is also last part, which is various. Now, deviation itself says a lot of things. Deviation means deviating from the procedure, deviating from whatever has been told, deviating from instruction, deviating from SOP. So deviation is not allowed. So deviation, if you want to deviate, you must report and record why you want to deviate. So when the TJ or FDA auditors do come, they always find out, do you have any deviation? If you have deviation, you must need to have proper reason why you have deviation. And deviations are allowed. It's not like deviation not allowed. There could be logical reason why there's a deviation. First thing is, you should not deviate. If the proper procedure is there, you should not deviate. But if you deviate, then you must need to write down why you are deviating. And again, because you are young kids, you must need to get approval from your senior why you want to deviate. So you are not authorized to do deviation on your own unless and until somebody tell you, okay, please deviate. Or this is my authority and these are the documents I'm signing. So these are the things very much important. And unless you, like as I said, TGA, FDA, or all other authorities, they're very tough with the license. If you do not comply with the requirement, then they can remove your license. In Australia, they can not just remove the license, they can put the owner of the company in a jail forever. It happened here many times. In fact, not only that, if the owner is not at fault, but somebody else is manipulating the data. Example, if you are a pharmacist or analyst, you are deliberately manipulating the data. If the TJ find out, you can be in a jail forever as well. And there is no mercy about it because you are dealing with the people's health. So whenever there's a people's health come in picture, government and authorities do not have any mercy about anybody. So here the rules are like this. I'm not sure about rules in India, but here the rules are like this, that the manager or managing director or owner of the company can go in a jail, or even analyst can go in a jail for falsifying the data. And this is what the TJ requirement is. So in a nutshell, as I said, I'm going back to my first sentence, what I said. You may manufacture fantastic product, but if you do not have a proper analytical chemist, the good product can go into garbage bin for non-compliance or not following the procedure correctly or not understanding the product. So hence, what I say to everybody is, guys, understand the chemistry, like understand the solubility. If you look at, there's one book in everywhere, I don't know whether you may have in your library, called Merck Index. I love Merck Index. Merck Index is such a beautiful book. It says what is appearance, solubility, pK value. pK value is a dissociation constant. pH, then it says about deterioration constant, lambda max. It gives you so much information. Just looking at that Merck Index, I love it. I know that, okay, I get unknown products, because my lab is known for testing all the unknown product. Whoever can't test it, they send it to my lab because they know Shrikant will be doing it. So as soon as I look at the structure, I look at the Merck Index, I'm happy. I just get excited. Yeah, so this is what it is. And furthermore, Shruti, let me tell you one thing proudly. This is my pharma lab. This is another food lab. I'm running this business for many, many years. We do not have any marketing person in our lab, not a single marketing. Our marketing is our people. People tell each other, okay, if you have difficulties, go to Shrikant. So we got a customer, whole Australia is my customer, whole New Zealand is my customer. I got customer from US, Canada, Germany, China, many customers from India as well. So we don't have any marketing person to go and tell about what we do to other people. People talk to each other. And as a chemist, as a pharmacist, your aim, youngsters, is for people to talk about you, not other people telling about your reference. They should be talking, hey, look at this guy, talk to him, he will help for you. And this is what you should aim. So I will stop now. You may ask me questions.
Thank you, Doctor. We are certainly proud of you. Being an
Thank you very much.
Indian, you went all the way from Mumbai to Australia and set up such a beautiful labs where people are coming to you for any new products. We are proud of you, Doc. As
Thank
a
you.
whole, what I understood is this is a message to my students that if you want to success in your life, you need to be thorough in your subjects. Without
Absolutely.
knowledge, you simply cannot grow. And
True.
I also appreciate and I know getting a good employee is the most difficult thing,
It
and
is. It is
having
more
all
difficult
the
part.
knowledge about their subject, and the most important thing is attitude to work, non-compromising in nature, whatever is there in rule and system, it has to be followed. You have to practice all these things, then you can be one. Another Dr. Srikant Dhumal, managing director of Chrome Laboratories. So this is a message to my students. Why I invited you, doctor? They should know. See, this Chhattisgarh, Jagdalpur, and Koraput, and all are one of the most backward districts of Odisha. Even in Maharashtra, there are so many backward districts. So I wanted to tell them, if you have dedication, if you have knowledge, if you are serious to your job, you can do undone things. The brightest example is Dr. Srikant Dhumal. Thank you,
Oh, thank
doctor.
you.
Thank you very
Thank
much.
you. Thank
Students, if
you.
you have some questions, quick questions, please.
Yes, sir.
Yes, Deepak.
Good morning, sir.
Good
Myself,
morning.
Deepak Kumar Bhatt,
Yeah.
student of B Pharmacy. My
Okay.
question is, what are the job opportunities available in Australia after our completion of degree and diploma?
Or there are a lot of opportunities. In fact, see what happened. You need to have some sort of work experience in India, because to have particular points, because you require certain points to get qualified to migrate to Australia. You must need to work at least 2 to 3 years in a pharmaceutical, either could be manufacturing or could be laboratory, whatever. Then you are eligible. Generally, what happened, the maximum points you get to migrate to Australia is up to 27 is the age, 27, 28. I migrated to Australia when I was 27-year old with my PhD and everything, with 3 years experience, with my 10 research paper I published in the US Pharmacopoeia as well. So yes, you need to do that. So these are the things you need to have some sort of experience, so you get maximum points. And furthermore,
Yes.
Shruti, let me
Any?
tell you one thing. I want to tell you something to
Yeah.
the boys. See, I own the business. It doesn't mean that I just sit in my office. My routine start 8 a.m. in the morning. Up to 12 o'clock, I'm in my office sending reports, sending email, replying to email. From 12 to 5 o'clock, I work on a bench with my staff. I prepare sample for HPLC, GC, ICP. I do titration. I do everything with my staff. So the reason I do it, because I can watch people, how they're doing it. I can also find out what mistake they're doing. I can train them immediately. And also, what it says that the people should not think, being a boss, I'm just sitting in my office and we are all working like donkeys in a lab. So they should not think that way. So I work on a bench, and I ask people, okay, how many samples you have for HPLC for me? Somebody said, okay, put these 5 samples on HPLC now, put these 6 samples on GC as well. So I do it. So I'm not a boss. My laboratory supervisor, he gave me instruction what to do. You know what I mean? So there is no such a thing that I'm sitting in my office. At from 8 to 5 o'clock in the evening, I go home, I do reports, I do training records, I verify all the documents, whatever I need to. But between 12 to 5, I'm an analyst. I'm working with the staff. So this is what it is. For being a successful person, you must be with your staff. Be with your staff, be with them, so you can understand their difficulties. You can understand how everyone can improve. This is what is required, and this is what I do every day.
So nice of you, doc. Thank you. Any
Thank you.
any question, guys? Okay, doctor. Thank you very much. I have a small last question. It is
Yeah,
on
sure.
behalf of students. Other than
Okay.
this testing and manufacturing, do they have in community pharmacy and all? Do Indian students are there after B.Pharm, they can join community pharmacy or health services and all in Australia?
They can. There are a lot of things available in a hospital or dispensing pharmacy, compounding pharmacy. There are a lot of opportunities there as well. But as I said, the minimum requirement is you must need to have some experience. Then you get maximum points. And because and there is no point going to the agent and paying heaps amount of money, because agents are there to cheat you, to take money from you, but they will not help you to get a visa. But if you got a proper experience, you don't have to worry about the agent. You just go to that website, apply for that, and you will have a visa immediately. That's not a problem at all. You know.
Okay. Thank you, doctor. Thank you very much for
Thank you very much,
addressing
guys.
our students and faculties. And
Thank you very
this
much.
is a small appreciation of certificate. This is
Thank you.
on mail and will be sending you by post. Thank you,
Thank you
doctor.
very
Thank you
much.
for coming. Thanks a
Thank you
lot.
very much,
Bye-bye.
guys.
Bye. Good day.
I want to wish all the best to my youngsters. Do all well. If you have any difficulties, please feel free to contact me anytime. And Shruti, please share my email
Thank you.
address
Yes,
to all
yes,
of
doctor.
them. And I really want to help my youngsters basically there, whatever I can.
Thank you,
Thank you
doctor.
very
Thank
much.
you. Thanks a lot. Bye-bye. Bye-bye.
Thank you, sir.
Bye-bye. Thank you. Bye-bye. Bye. Bye.
Go and have their lunch and all.
Okay, now you can go to lunch and do your activities, and we will resume at 3 p.m. So everybody is instructed to be there on time without delay. Okay, thank you very much. Now we can disperse.